Therapists want to work safely with their patients. Patients want to work safely with their therapists. In order to do that, therapists need to learn how to assess the level of safe attachment their patients are at so they can offer a safe working alliance. How do we assess? The therapist offers a relationship that is based on what the patient wants for himself. Therapist: how can I help? The patient will start to show the therapist through words and deeds her attachment patterns that she needs help with. One patient can respond with real fear, looks afraid, fear in her eyes. This lets us know that depending on another person brings up a memory of being hurt, and the patient, on some level, experiences the therapist and other people as going to hurt her. If the therapist sees that response a few times as a pattern, he can help the patient with her conflict and her reality testing in relationships in a safe way. Another patient can respond in a detached tone, looking at the therapist's eyes and saying, "Patient, well, I really don't know. My friends told me that it is time to go to therapy, so here I am. What do you want me to do?" This patient has no problem saying what other people want him to do. He is not anxious at the moment and feels very comfortable. When the therapist sees this response a few times as a pattern, he can safely start working with what the patient is enacting in therapy and with other people and focus on what the patient wants for himself. When the therapist is not taking the bait the patient is offering, which is, "Let's talk about what you and others want so I won't get any help." This helps the therapist invite the patient's will for his benefit. The therapist can work in a safe way with the patient responses that will keep telling the therapist what the patient needs help with. Remember, the patient is showing his attachment patterns and behavior not towards the therapist, but to who the therapist represents. Remembering it and working with this in mind can help therapists work in a safe way with their patients with what they really need help with. Thank you for watching, and keep up the safe work with your patient, assessing their needs from their behavior with you in therapy. See you next time.